So each clinical center has an access point, and then we provide to the end users a USB stick that contains his credentials to enter the system. So here the demo, we have 2 workstations connected to the system. The gateway that we are using is a development gateway that we have here at MAT in our building. So we are mimicking a complete hospital set. The solution that has been developed is portable, so the stick that we hand over to clinicians contain cross-platform software that can be run under different operating systems. The point is for them to be able to run, to get connected to the system and use the applications from different workstations within the hospital, and not having to bother about actually any additional software requirements. So the first time you plug the stick in, it auto-loads, auto-starts, and the application that you see on the screen is actually the first thing you see when connecting to the system. This is the authentication to the Healthy Child infrastructure. It's a 4-step authentication. First step, we check that the credential of the user is on the stick. Second step, that the access point is available for connection. And then we start authenticating. So here we use electronic identities to encrypt all communications, also to know the identity of the user and to provide more adaptive access to the system. And once you've gone through these 3 steps, you basically are connected to the large infrastructure. So you can access the data from remote centers, you can start the applications and so on. There is a 4th step, which is additional connectivity that we've developed for the sake of handling private data. As you know, within the grid, as we are sharing between different hospitals in different countries, everything is anonymized before it gets stored in the grid. So we've developed what we call the P2P3 network, which stands for peer-to-peer patient privacy, which is a database plus some connectivity that is given to the end user as a facility to store private information outside of the grid, but mapped to the anonymized data within the grid. So once this is completely successfully achieved, the application goes to the sys tray of the end user in his operating system session. So in the taskbar, there is an icon, and if I right-click on the icon, I have access to the portfolio of applications provided by the project. So I do have different applications. Here it's my login, so I have access to more administration stuff. We provide applications for basic querying the system, more advanced semantic-based browsing, and then applications that are more specific to the different fields we are dealing with.